So, good evening to all of you. Our topic of today is Future Vision, Recoding Leadership to Fight the Next Corona. Before we start, a big hello to all our viewers and audiences on SAVIOUR Saturday on the Voice of Healthcare Network. I'm Prashant Mishra and I'm the MD for British Medical Journal Publishing Group in India and South Asia. Today, we are really fortunate to have with us Professor Dr. Mahipal Sachdev, a Padma Shri awardee and CMD for Center for Sight, New Delhi. So, this program today aims to discuss breakthroughs, developments, and trends that are acting as a lifeline or SOS for the world with timely disruption, rescue type intervention, or life saving, lifestyle altering impact. We'll try and have a free flow chat today. Our audiences and viewers are eager to know your esteemed views, Dr. Mahipal. And so, without much ado, let us begin. And if I may ask you, why don't you start by sharing a word about yourself?
Thank you very much, Prashant. A pleasure being with all of you. And I am Dr. Mahipal Sachdev. I am Chairman, Promoter, and MD for Center for Sight Group of Eye Hospitals. I am a graduate, a postgraduate, and an ex-faculty from the All India Institute of Medical Sciences, having spent 20 years there. And in between, for 1 year, I went to Georgetown University, Washington, D.C. for doing my fellowship in cornea. And after leaving All India Institute of Medical Sciences on my own accord, I started Center for Sight Group of Eye Hospitals. And from 15th of March 1996 to almost now 25 years, we have progressed and we are in 11 states providing eye care services in about 30 cities, and we have about 45 centers to date. We are primarily north-centric, central India as also western India, where we have the services, and now we have forayed into East India. That is, we have gone to Kolkata, Patna, and those are our forays into East India. We have had private equity infusions by Matrix Partners, and after giving Matrix Partners an exit, we are now having equity participation by Mahindra and Mahindra, that is Anand Mahindra's group. So we are having close to 150 ophthalmologists who work with us, and we are one of the largest chains of eye care, super specialized eye care centers, having super specialization so far to say that we have one of the best centers for ocular oncology in this part of the world at our Hyderabad centers. So I think briefly that is what I'll wish to say about Center for Sight, and we have DNB programs, we have fellowships, we have research going on. So it's a composite eye care delivery model that we run at Center for Sight.
So that's very useful, Dr. Mahipal. Let me start by asking you some questions. So my first question to you here would be, today the infrastructure and supply chains of healthcare providers are being challenged, and healthcare frontliners are working tirelessly to provide treatment and support in a time of unprecedented demand for patient care. And if I were to ask you that one question, that is in the mind of the frontline healthcare providers, it is most likely to be, can we do more with less? So that's more about the efficiency and with less number of resources. So what's your take on it?
So actually, the COVID pandemic has really put a lot of stress and strain on the already poor infrastructure of healthcare that India has. Unfortunately, healthcare has never been recognized as a priority area by the government. And even from private investments, the return on capital, etc., which is there, is not too high. So the growth of healthcare has not been significant in India, and this COVID pandemic has really struck very harshly. Now the problem is that a lot of patients don't want to go to the public healthcare facilities because of the lack of infrastructure and even at times lack of medical and paramedical workers. So the entire stress and the burden has fallen on the COVID warriors who are in the private healthcare system. Now, what happens is that India, being a developing country and a lot of people insurance onto them, there is an unnecessary stoppage of the payments by the government. That means that they have restricted the amount of payments, and all the big private hospitals are, as things stand today, making losses. So there are only two ways: either the input or the inflow of money increases, as the beds have been reserved for COVID, and rightfully so, that there have to be beds where COVID patients have to go. But the question of sustenance is very, very important. So either the outflow has to be decreased or the inflow has to increase. And that is what I would say, that what you mean is that we can we do more with less. So I think all of us have to be frugal in spending our resources. There is obviously a problem of healthcare personnel who can actually fight COVID, because there is still no standard treatment which is there. There is a requirement of ICU beds, which obviously are limited. There is a requirement for ventilators, which India does not have to that extent. Whatever was the first wave, I think the worst is coming. Say, for example, in Delhi, every day we are having about 4,300, 200, 4,400 cases that are coming. And the patients require the hospitalization when they get into serious trouble. And the mortality is close to 2.5, 3%. So that is something which is very, very important, that whatever may be the mortality, we have to reduce the outflow, because the inflow, the elective surgeries have dried up. We in ophthalmology, for example, felt the strain significantly because we do a lot of cataracts, and these are patients who are old or elderly patients, and they don't want to venture out of the home. So inflow having been severely constrained, the outflow is the only way where we can reduce the spends. So whether it be optimization of the medical care, that means that how much time a doctor is coming, and whether you have to break them into shifts. Because see, the problem is, if doctors and paramedical staff get the infection, then the whole kind of paraphernalia, or the people who are working in that shift, may need to be quarantined. So therefore you have to split them into one, two, three various shifts, so that you have to work there. And the other thing is that there have been salary cuts which have been there all across. The elective surgeries having gone down, all hospitals are making losses. But the only problem is that you are actually spending more, because you have to have the PPEs, you have to have sanitizers, you have to have people taking care of when the crowd is coming in. So I do not see any specific instant solution without the help of the government. The government needs to give money, which has been given across countries, to the healthcare system, which has not been given by the Indian government so far. So all that the hospitals have to keep afloat, they have to work on their own. So whatever way it is, whether it is marketing activities, obviously they have gone down significantly, whether it is travel, that has gone down significantly, the conferences. So all these unnecessary kind of activities, unnecessary, I would say necessary in the earlier time, but in the new normal, or what is happening just now, whatever are the activities which are not essential for providing care to COVID patients, etc., have to be taken off. सो दी मीन्स हैव, जैसे हिंदी में कहते हैं कि आप अपने पाँव उतने पसारिए जितनी चादर है, दैट इज व्हाट इट हैज टू बी. और इफ यू लुक एट से द आर्किमिडीज प्रिंसिपल, that if a body is floating on water, it depends on the amount of water that is being displaced. So the amount of water that is being displaced, then you have to reduce the weight of the body to keep afloat. So just now we have to just keep our head high. We have to keep our spends low as much as possible, and all of us are working together. I think the organizations are working where everyone has participated by even taking cuts in their payouts. That is what is very, very important. I think the battle is to make the people survive the COVID, and also to keep the hospitals surviving. As you may know, there are several smaller hospitals that are closing down, and there is severe stress on even bigger hospitals, which is there. Something has to come, because this is not a small problem. It is not going to end tomorrow. The Nobody has seen the end of the tunnel, whether it is 3 months, 4 months, 6 months. Vaccine development took a problem, because there were case who got transverse myelitis, so that has slowed it down. So I really don't know as to when this problem is going to end. And the healthcare industry has taken a hit, which a lot of people, even the report which has come from the Kamath committee, has not recognized healthcare as an industry. It has just taken a hit. People feel healthcare has grown, pharma may have grown or may have prospered, but healthcare has not grown and not prospered. So I think we are fighting a battle only with our own resources, and we have to try and do much more by economizing on unnecessary spends or bringing in frugality. So that is my only message as I see the whole scenario just now.
Right. So let me then ask you my next question. So, considering your decades of experience in the field of medicine, I'm sure there might be uncountable challenges you and your peers might have faced. Do you think the change in Indian healthcare system was overdue and it got speeded up because of COVID?
Yeah, so obviously the challenges, as I said in the previous answer also, that in India you have only about less than 1.5, maybe about 1.28 or 1.35% of the GDP that is spent on healthcare. And if you look at say US, it's above 15%. So India really does not have a great system. The problem also of inequalities is there. That means that a type of healthcare delivery that you are expecting in a good hospital and what you get at a district or maybe not a district or taluka level or whatever, that is very, very uh, abysmal. The other thing is that, as I said, the government does not have the resources and the private investments are not coming in because people are trying to control the spends or the costs in healthcare that is happening. Now, let me just give you an example. The GIPSA or the insurance industry, whatever was the amount that was paid 10, 12 years ago, say for a cataract surgery, it is the same or they're trying to reduce it while all the other expenses have gone up. Now, investment has not, have you heard of any investment that has come in healthcare during the COVID time? I don't see any investment that has come in any of the healthcare or new hospitals having been announced while you're getting a lot of investment that are coming into the digital space. So the digital space within healthcare is the only place where I am seeing a revolution that is happening. The good thing that the government or the MCI did was to have tele consults or telemedicine legalized, and that has seen a significant growth in various specialty by about 3 to 5 times. In ophthalmology, there is a 700% growth that has happened. So this is something which I will say that this has speeded up the whole thing. That is teleophthalmology, telemedicine. I would say in a broader term, telemedicine and home care. So these are the two things which are getting revolutionary, and digitization. So digitization as to how you can transfer data so that from a remote place to work. The other thing that is happening, but at a much slower pace, is what the Prime Minister has said, Atam Nirbharta. So again, from the first point which you said, how we can reduce the cost, I think Indian companies have to come forward to provide technology, to provide consumables to the Indian patients at a fraction of the cost from what we are getting or we have to import from outside. But for that, you need incentivization by the government. You can have medical parks that can be created. Land should be given at a much cheaper rate to the hospital industry. The only positive that I have seen so far is that the telehealth, which can provide the healthcare to a limited extent, is available to all the people across India. Now, digitization of the record is another big step that has happened. Ayushman Bharat was something that they have brought the penetration of giving insurance to everybody, and that I think is getting speeded up. And digitization or the digital record of a patient is the other big thing that has been announced very recently. So their greater emphasis, I think, or the greater development, which I think has been much faster than we had expected earlier, is in the digital space, teleconsults, and giving prescriptions over the video conferences, etc., etc. So that is the big thing. But infrastructurally, I don't think there is any fresh investment that has been announced anywhere. You have had these makeshift hospitals that have been created, say in Delhi, in Chhatarpur, etc. The DRDO, etc., and the army has created it, but those are makeshift. But real-time changes have not happened except digital world of in healthcare.
Okay. So, in the short span of time since the emergence of COVID-19, we have already seen significant changes in the way that healthcare is delivered. And you just said about the telemedicine, telehealth, digital health. So undoubtedly, the pandemic will have a profound impact on the whole industry for years to come. So for a point of view like yours, who has already seen drifts of transformation in healthcare during your work span, how do you think healthcare professionals are gearing themselves up for the battle ahead?
So I think the biggest thing among healthcare is that the current generation of healthcare people who are slightly older are flexible, but the next gen I think is totally malleable. The only thing that is going to be in good stead, I would say, is that you need to be very, very adaptable to change. And normally you say you have to steel yourself or you should be rock solid or like a steel, but in this particular case I would say that you have to be adaptable like water. So the changes are going to come. They have to come because there is a new normal, and none of us at the present moment knows what is the new normal. So, for example, if we are looking at a patient of glaucoma, so nowadays we are saying that otherwise, if we would have wanted the patient to come every 4 to 6 weeks, now we would want the patient to come every 6 months. So, the same thing is going to happen is that uh, I would say the hypochondriacs or the people who are just wanting to come and not having a serious problem, they will be sifted out because of the telemedicine, teleophthalmology. But the real patients are also taking a blow. One of the things which people are saying is that the children didn't come for immunization because of the fact. So there could be a new health problem or a new health challenge that we are going to face. So there has to be delivery at the doorsteps, which I feel till the COVID pandemic ends is going to be the new normal, where we have to adapt, and we have to adapt with a significant speed that is there. So we have to read, we have to innovate, we have to adapt, and we have to adopt. So these are the things which is the battle which is there. And apart from that, the most important thing is keep your patients safe and keep yourself and your staff safe. So you
Yeah.
cannot let your guard down as regards the safety profile. So that is hours have to be changed as to a person. You have to spread your working hours. So earlier, if we used to work 8, 9, 10 hours, you will need to keep the OPD open for 14 hours so that the patients can be spread out. Social distancing or physical distancing, etc., has to be there. So patient has to be made comfortable visiting the hospital, and apart from comfort, there is the safety which has to be ensured. And that is what is happening in things. And aggregation and consolidation is the other thing that has to be done, because you have to cut down the cost, and that can only happen if there is consolidation and there is bulk purchasing and bulk buyings, etc. So that is where I'm just feeling that these are the things that will be happening in due course of time.
Right. So, having asked you some formal questions, let me ask you some informal ones now. So, being
Yeah.
associated with the healthcare industry for so long, if I may ask, what is the one thing that you experience as the biggest challenge, or if there is a so called mantra that helped you come all way along? And if you could share it with all of us.
Okay, so see, when you are in healthcare, having spent since 1976 as an MBBS student, having spent more than, I would say, 40 years just now, the most important thing that this is a long-term play. This is not a short-term play. Until, of course, you are doing something very, very innovative. If you are in the service industry and you are delivering healthcare, what is of paramount importance is to build your brand and your reputation. And that brand and your reputation has to be how you differentiate yourself. So I normally tell the younger people that you need to have a USP. And what is your USP or your unique selling proposition? Because that is something very important. So as I would say that at a particular time when I ventured into eye care in the private space, there were very few people who were doing the no stitch cataract surgery, that is phacoemulsification. And being a pioneer in that, being a pioneer in technology and also in LASIK, I was able to establish myself as somebody who was doing something different. But today, if you are saying that I come out in the private practice and say that, or build up an institution, that I say that this is going to be my USP, that I am doing phacoemulsification. It is not going to be, because almost everybody is doing that. So you have to have something different from others, whether it is low cost eye care or healthcare, whether it is going to an underserved area, whether it is giving a super specialized eye care, whether it is early adapter to technology, whatever it is, you have to be slightly different. But in the long run, trust, technology, and transparency is something that is going to pay. There are no short term gains that one can look at. You have to play the game for long term gains, and it is only if you are establishing yourself as a brand with a goodwill, that if I go to so and so place, I will get a good treatment, and which is I would say people almost take always second opinion. So I would never give a wrong opinion to a patient to force somebody to do something, because that is going to be counterintuitive or counterproductive. So honesty, integrity, compassion, and transparency, I think these are the things that I have learned. And technology skill acquisition, I think these are the things I have learned during my stint in healthcare. And obviously taking calculated risks. There has to be a lot of study, but I would say at times it's your gut also which helps you feel that this is something, this technology or this thing is going to make things work differently. And first adapters at times do have a possibility of failing in that particular thing. The other thing is that I feel that whenever you are working in healthcare or any other place, it's like a treadmill. Even if you have to be at the same place, you have to keep running. So never rest on your past laurels. You have to change, you have to adapt, and you have to be leaders and pioneer in particular things. And nothing comes for free. I would say that you have to work very, very hard. So you have to embrace change and move forwards. If you don't embrace change and do not move forward, I think you will perish. So that is something very, very important. The mantras that I feel have been there for me to make to be successful. And obviously the urge to remain impatient, the urge to do more. The calling is that you should not be satisfied with what you have achieved. You have to keep on doing more, and you have to work sincerely with the patient. Since we are old, dealing with a lot of old patients, a word of uh, just a solace or a comfort or patting the patient on the back, etc., that those are small little things which can do. But ultimately at the end of the day, the results count. That you have to do clinical audits, you have to see where you are having complications, and you have to have results which need to come up to the expectations of the patient, and they need to be world class. That is all that I will say is the mantra, I would say, for healthcare and being successful there.
No, I'm sure. I mean, I have listened to you quite attentively. So, especially your message for the younger generation around hard work, transparency, integrity. I think these are very well said, and I'm sure the next generation will pick up. So, it's like being a Karam Yogi. So, which is all very interesting. So, let me ask you another question. And I'm sure everybody has an idol or maybe a leader they look up to. So, is there any specific leader who has inspired you to be the person you are today?
Okay, so I will wish to say, I won't give one name, but I would wish to say three things. The first, I would not say as a leader, but as an institution. I think it was my privilege to be at the All India Institute of Medical Sciences, which till date I would say is the best medical institute for training, for learning, for skill development, for whatever you want to do, extracurricular, everything was there as a whole personality. So I think I owe a lot to where I am to All India Institute of Medical Sciences, and then subsequently within All India Institute of Medical Sciences, the Dr. Rajendra Prashad Center for Ophthalmic Science. And then if you are looking at human beings as my role models, there are two of them. The first one is Professor Dwight Kavanagh, with whom I was there for 1 year in Washington, D.C. at Georgetown University. And I had in 1986, I had gone to make a presentation in the World Congress of Cornea. And after making my presentation, he walked down from, he was sitting, he was the chairman of that session. He walked down and he came down to me and he said, "It's an excellent presentation, etc., etc. Why don't you come and work with me?" So that was, and then I followed it up. I became a faculty in 87. So I followed it up 2 years later. And 89, I went there for a fellowship. So this guy was he was the youngest person to be appointed as professor in ophthalmology at the age of, I think, 35 or 36 at Emory Eye Institute. And he was so very focused in his work, and he was aspiring for a Nobel. So, though he didn't get a Nobel Prize till now, but he was aspiring for a Nobel, and he was doing path-breaking work on confocal microscopy, endothelium, etc., etc. And that is what changed me to a significant extent, that you should never be satisfied. Even though he became a professor at the age of 35, 36, he was still aspiring and doing and working very, very hard. So this guy taught me of working hard, being innovative, and being thinking, and to think big as to how you can achieve certain things. And the second person when I left AIMS in 1996 was Dr. Pratap C. Reddy. I think I was maybe a blue-eyed boy. I left, I joined Indraprastha Apollo Delhi in 1996 March, and in July I did his cataract surgery. And anywhere he could just, I could walk into his room, etc., etc. But there were certain things that I learned from him. I learned from him how healthcare could be delivered in the private sector. I learned from him confidence. At that time, he said, do not worry, set up a facility in India and the patients will follow. So he was never afraid of going. The same thing at that time, Ahmedabad Central Hospital was also said, even though it was far away. He says, India lacks these facilities and we should put them up and we should give them good quality care. The other important thing he said, love Apollo or leave Apollo. So that was something which he put in everybody's mind, that you have to be part of the Apollo family. And it is a teamwork that matters, which is there. And again, his thinking was very, very big. It was something which he was very clear that he had conviction in himself, and he had conviction in the need for healthcare in India. So I think these are the two people whom we have. And one more instance I would wish to say is that I was doing pretty well. There was some instance where a couple of the consultants were unhappy about the way I was progressing as compared to them. And as you know, in healthcare, there are lots of jealousies and things like that. And I just happened to meet him. I said, sir, it's not really good that I am doing my work sincerely and things are happening. So one dialogue I still remember, he says, when elephants walk, Mahipal, don't worry, dogs will bark. So that is another ideal. He said that be steadfast in your work, in what you are doing, and do not be bothered about what others are saying, as long as you are clear in your conscience and in your heart, and you know that you are doing well and you are doing the correct thing for the patient. So I think these are the two people, Professor Dwight Kavanagh and Dr. Pratap C. Reddy, as individuals who have been my role models, and the All India Institute of Medical Sciences for giving me what I am today as regards my professional knowledge and my skill sets.
Yeah. And I think just to say that what you just said in the end, doing the best for your patient, so the patient outcomes, that remains the end goal or the result. So I think that's very, very inspiring to hear. So if I may ask probably the last question to you. So what do you think of the Voice of Healthcare broadcast?
So, well, I think Voice of Healthcare is doing a great job. And I think what is important is that people have to be sensitized about healthcare, the needs of healthcare, the transformation, what is happening in healthcare, what are the advancements that are happening in healthcare. And whatever said and done, I think the healthcare professionals, even today, we are having people enjoying thalis and congratulating Corona warriors, but there is a kind of mistrust that is there in the people. And I think Voice of Healthcare is doing something very great, that you are bringing out the positives and the energy level and the things that the healthcare professionals are doing, putting it in the proper perspective. So keep up the good work. And I think every small little drop counts in the ocean. So we will need to change the mindset of people and to give them more knowledge in their hands, so that they actually go out and get the best healthcare delivery. So Voice of Healthcare is another such kind of a innovative idea that you people have come out with, and that's a great thing that you people are doing for the betterment and improvement of healthcare delivery in India.
Okay, so that was for the Voice of Healthcare staff. I'm sure they would be happy. So I wish we could go on with this truly engaging discussion, but as always, and unfortunately, that's all the time we have today. So thank you, Dr. Mahipal, so much for wonderfully illuminating and inspiring session that you had. And I'm sure the points and themes we touched upon today will provoke positive thinking and trigger timely interventions within the healthcare community not just in India, but across the globe, and play an important part in taking us all forward together. Our viewers and audiences
Thank
like
you.
me are grateful to you for sharing your precious time and esteemed opinion with us. Just for the viewers, from the Voice of Healthcare, they really appreciate your tuning in today, and we hope you enjoy today's episode. Till the next, that's a goodbye from all of us. Thank you so much.
Thank you. Pleasure being with you. Thank you.